2,044 test results received by the Ministry of Health between the period of 20th to the 22nd of November 2020, and 8 were positive for COVID-19. And it should be noted that this does include the cases that we previously reported on Saturday and cases. One of the new cases is classified as imported with the details as follows. It was a non-resident 2020 who tested positive on their day 14 test and had been in quarantine as a close contact of a known case that was identified upon arrival on that same flight. The remaining 7 new cases had no link to travel. One of those new cases is classified as local transmission with a known contact. In other words, this is a resident who had close contact in a social setting with a known case currently under investigation. The remaining 6 new cases are related to a workplace setting with the details as follows. 2 residents currently classified as under investigation and linked by close contact in a workplace setting, and these were the 2 that were identified over the weekend. And 4 are also residents classified as local transmission with known contact, having had close contact in the same workplace setting as the 2 above cases that I just mentioned that are currently under investigation. Bermuda now has 235 total confirmed positive cases, and their status is as follows. There are 22 active cases who are all under public health monitoring, and none are hospitalized or in critical care. A total of 204 have fully recovered, and the total deceased remains at 9. The average age of all of our confirmed positive cases is 53 years of age, and the age range of all of our age of all deceased cases is 74, and the age range is 57 to 91 years. The source of all cases are as follows. 114 are imported. 97 are local transmission with a known contact or source. 21 are local transmission with an unknown contact or source, and 3 are under investigation. As a reminder, persons remain under investigation until a linkage is found or up to 28 days, whichever is longest. If no linkage is found, these persons will move to local transmission with an unknown contact or source. The 7-day average of our real-time reproduction number is less than 1. Bermuda's current country status is sporadic cases, but it is likely to change to cluster of cases. This is because some of our active cases are within well-defined clusters and have not been directly linked to imported cases. With the recent uptick in cases and foreseeable change in country status, I would like to re-emphasize the crucial importance of following all of the public health protocols. Wear your masks, practice physical distancing, cover your cough, stay home if you are sick, and avoid the 3 C's: closed spaces, crowded spaces, and close contact settings. Imagine that everyone outside of your household is a potentially incubating carrier of COVID-19. Would you shake their hand? Would you share a meal with them in a tight space with very little ventilation? I know that we are all suffering from pandemic fatigue, but we've given up so much for these last several months, and we are so close with a vaccine in sight. We need to hang in there for just a little while longer. The vaccine is not here yet, and if we are not careful, we could be overrun with COVID-19 before the vaccine even gets here. The current uptick in cases this month has taught us several things. Firstly, more focus is needed with respect to education bubbles, and this I mean bubbles within the school settings. Even if a school class is separated from one another, it does not count as a bubble if they all play together at lunchtime. Secondly, additional rigor is needed with respect to workplace guidance. There's an abundance of workplace-specific guidance on the government website at coronavirus.gov.bm, but I will provide you with a few key points now as it relates to office environments. Remote working should be encouraged if possible. Consider using team bubbles for your office staff. For example, 1 week, half of the staff are in the office, and the next week, the other half are in. Encourage employees to stay home if unwell. Encourage employees to wash their hands and use hand sanitizer often. Employees should work 6 feet from others or 3 feet if wearing masks. Staff should hold virtual meetings where possible, and where remote meetings are not possible, staff must be 6 feet from others and no more than 10 persons in a meeting. Employers should review options for increasing ventilation. Consider air purifiers as an example. Employers should also review how persons enter and leave the workspace. How can you reduce the overlap of employees or increase disinfection? Where located in multi-office buildings, identify designated entry and exit points to minimize worker contact while moving throughout the workspace. Employees should wear a mask whenever moving around the office, and management and workplace leaders need to know the signs and symptoms of COVID-19 and not allow those with symptoms to remain in the workplace. And finally, consult the return to work recommendations for businesses at coronavirus.gov.bm. There is special guidance for returning to work following travel. All workplaces, schools, churches, clubs, bars, restaurants, everyone must review their COVID-19 policies to ensure that they are strictly in accordance with the public health protocols. This includes recording the names and contact details of all patrons. And members of the public can report any infractions that they observe by calling 211. The Ministry of Health is currently reviewing its guidelines to see if they need to be adjusted in light of the uptick in new cases. And finally, if you're unwell with COVID-19 symptoms, call your doctor and get tested. It is important that you do not turn up to your doctor's office without first calling ahead. And also, please make sure to bring your ID with you when you are going to get tested. Thank you again, and I'll see you tomorrow evening.
Good evening, Don Burgess, Bermuda Broadcasting. Health Minister, what is the most likely explanation for how this recent person without a known contact or travel history managed to catch the virus? Is it likely that someone who slipped through the COVID testing shield and asymptomatically spread it into the community?
Can you repeat your question, Don?
Sure. I'll try to read a little slower too.
Okay.
What is the most likely explanation for how this recent person without a known contact or travel history managed to catch the virus? Is it likely that someone slipped through the COVID testing shield and asymptomatically spread it into the community?
I'll yield to the CMO, but of the ones that we've just reported, again, there are still investigations that are undergoing, and we will not complete the investigations until the end of 28 days. If we cannot, at the end of the 28 days, ascertain how the person caught the virus and from whom and the circumstances surrounding that, then we'd have to classify that person as an unknown contact or unknown source. But we're still in the process of investigating.
Thank you. As the minister said, this is still under investigation. There are different reasons where that could be why that could be the case. It's important not to speculate because it's difficult to know for certain, but there are different reasons. The first thing I would say is that no test is 100% accurate. So in spite of our best efforts, and we're confident we're catching most of the people who are coming through our borders, it's not outside the realms of possibility that someone could have slipped the ball protocol. However, the investigations we're doing at the moment would help us know if that has happened, because those people will have developed antibodies, and antibody tests is one of the ways we're trying to find out where the possible exposure could have been.
Okay, thank you very much. With the group of 8 that was announced this evening, were there any children in that group, or what was the youngest age?
The group of 8 that I was referring to this evening were all adults.
All adults. Thank you very much. How big of a problem does the government's tracing and surveillance team think this cluster is causing at the moment?
I'll yield to the CMO, but I'm not going to say it's a problem because we have we're fortunate enough to have a very, very hardworking and dedicated team of epidemiology and surveillance led by the CMO, who have been working day and night to do the investigative work, the contact tracing, which I know you're more than most very familiar with. And I wouldn't say it's a problem. Obviously, it's a concern because we're seeing an uptake in cases. However, at the end of the day, we do have a very skilled professional staff that are taking steps to complete the investigation. And as I've mentioned previously, having an increase in cases, we're not surprised. Our borders are open, and we're seeing that our number one trading partners, namely the United States, are also having a second wave. So it's not a surprise that we would see more persons coming to our shores from the United States in particular that have a high prevalence of COVID.
Thank you. Thank you for your kind words, Minister. My team is set up to investigate this, and I wouldn't exactly call it a problem because that's what we are set up to do. And as the minister has kindly said, the team is really looking through and leaving no stone unturned to find out first where this the index cases got the exposure first of all, and also to find out the extent of spread of this. So it's not exactly a problem. It's something that we have been set up to do and something that my team are comfortable doing.
Okay, thank you very much. Was going to direct this one on to the Premier, but Health Minister. On Sunday, there was more than a 5-hour gap between the first news report that some school students were being quarantined and any official public communication about the matter from government. The Premier tweeted about the Bermuda rumor mill being in full force. Doesn't government think that leaving several hours of information vacuum is unfair to the public in such a situation? Because there was supposed to be a press conference at 8, and then that didn't happen.
Right. You'll have an opportunity to ask the Premier that tomorrow. But as you know, that I was one of the parties that was part of the taped recording. And when it was determined to make a press conference or to have a press conference to try to alleviate some press releases, to try to alleviate some of the concerns, we were still in the midst of our fact finding. And I didn't want to find myself in a position where I'd be releasing information to the public and not be able to have as much detail as I could. So unfortunately, those circumstances did take a little bit longer than anticipated. We're dealing with contact tracing for 8 individuals, and I did not want to be providing less information that was absolutely necessary to the public. So that's one of the reasons, the principal reason why it took us longer to be able to have that press video conference yesterday, because we were still in the process of doing fact finding and investigating the information so that we could provide that to the public in full disclosure and transparency.
There was a change yesterday from what's been past protocol. In past incidences, places have not been named, like when the first case was at BHS or at the nursing homes, they weren't named. But yesterday, government did name the 3 schools that were involved. Why was the change?
Well, as we said previously, unless it's a public health reason, then we do not disclose that information. However, social media being what it is, persons were, it was a mass frenzy this weekend with respect to social media. So that information was already within the public remit.
Okay, my last question for tonight. Teachers have been sending messages to parents today to find out if their children have access to computers, laptops, or tablets, and if their households have internet access. Is this just a precaution, or are we preparing for another period of remote learning?
I would certainly invite you in the first instance to direct that to the Minister of Education, who'll be able to be in a better position to answer that question.
All right, thank you very much.
Mm-hmm.
Thank you very much. Fiona McWhirter from the Royal Gazette. With regards to some parents from some of the schools that have been affected over the past 3 or 4 days, it seems that some parents have had advice from the COVID-19 hotline that says they can go out and shop for groceries if they've had a negative test result returned to them. Seems to be that a school nurse is saying that's not the case and all family members must remain at home until guided by the Department of Health. Can you please advise why the discrepancy and which is the position that they should listen to, adhere to?
I'll answer that, Minister, if that's okay. I'm not sure where that information came from. If people have been asked to quarantine. In this instance, I presume you're talking about the children in the schools that have been asked to quarantine. The quarantine requirement is for the child in question and the primary caregiver. Um, what we discuss with this parents and the caregivers is that try and quarantine the child and the primary caregiver and the other members of that household if they can be successfully isolated from the child, and the caregiver don't need to be in quarantine. So that's probably where that nuance was probably not properly explained, and that's is what I imagine is responsible for that discrepancy. So, for the avoidance of doubt, if you've been asked to quarantine, please stay away and stay at home for the period of time that you've been asked to quarantine. And because this involves children, we expect that a caregiver would need to quarantine with the child.
Thank you. And again, just for the avoidance of doubt, then, if it's the case that a family, say a family of 4, for example, live in a house whereby a child and a caregiver cannot isolate themselves from the rest of the family, that means all 4 people are within the confines of the household for 2 weeks, for example.
Correct.
Thank you very much. The Premier has tweeted today with regards to the Cabinet considering perhaps some additional restrictions at its meeting tomorrow. Minister of Health, can you give any guidance on what those might be? Maybe what some of the kind of top tier restrictions are that might be implemented or what might be up for consideration?
As the minister said, those are things that we will discuss tomorrow. And fortunately, you'll see me here around the same time in 24 hours. So we'll be able to provide further information following the Cabinet meeting.
Thank you. And you couldn't say, I guess, at this time, whether or not any sort of lockdown with schools open but shops and businesses closed might be under consideration?
I will be able to provide you more fulsome discussion and information tomorrow at this time.
Understood. Thank you very much. And with regards to perhaps just following on from something mentioned earlier, as you pointed out yourself, there was mass frenzy on social media and some misinformation was circulating over the weekend. If there was a similar situation to come in the future, would you consider perhaps even putting out a holding statement, just something brief to let members of the public know, even, for example, what schools were affected and to what extent, so that perhaps some of that misinformation is limited?
I think I'd like to answer that, Sarah, by saying it is critically important. And I know people like to run to the rumor mill and like to run to social media. And in this instance, social media is certainly a curse. I think it's critically important for members of the public to recognize that there are protocols in place and that the Ministry of Health team will be the ones to communicate to those persons affected what steps need to be taken. So if you do not hear from the Ministry of Health team, don't rely on social media. I think somebody sent me something that said, Minister Wilson said, and I didn't say anything, but I'm just saying, it's just, just recognize members of the public. And I understand that the media frenzy is alive and well on social media. But if I can implore persons to recognize that in the event that they need to be contacted by the persons at public health because they are a contact, et cetera, they listen to them. They will be the ones that will call you. No one else. Don't worry about what you've read on social media. Don't worry if somebody else calls and says that their cousin twice removed is positive and that all persons within a 10-mile radius of their home need to be quarantined. Wait until you hear the advice from the officials at the Department of Health.
Thank you very much. And you mentioned with regards to perhaps a change in country status we might have, perhaps going from that sporadic cases to clusters, I think you mentioned.
It wouldn't be a change in our country status. It would be a change in how we identify our cases.
And in which case then, perhaps either yourself, Minister, or Chief Medical Officer, can you remind us, please, when we might see or be in a position whereby it would be termed community spread? I understand that's when there's a lot of cases that can't be linked back. Is there any figure for that?
I'll yield to the CMO, but the current country status, you're right, Sarah, is sporadic cases, but that will be likely to change to clusters because there are some active cases that are not affiliated with travel. But I'll yield to the CMO for the second part of your question.
You want to know if there's a number. Unfortunately, there isn't a number because it all depends on the size of the country in question, and we're smaller than many other jurisdictions. So that's we can't give a number, and WHO doesn't consider a specific number. It's more about one the number how the cases are spreading in the community, and B, your ability to respond to those.
Understood. Thank you both very much.
Thank you, Fiona.
Further questions? Thank you, Minister. Thank you, CMO.
Thank you.
Thank you.